so Dr. Prucz, Phoenix Plastic Surgery. We're in the operating room today doing a very large tummy tuck, or some would even call this paniculectomy. So I want to first show you the amount of tissue that we took off this patient's abdomen. We're actually going to take more here in a little while, but this is our initial excision of the transverse wedge. We're also going to do a vertical wedge in order to tighten her in the vertical component through a vertical vector. I want to show you also what happens in exceptionally clear diastasis. So if you look here, you can see rectus muscle, and this patient has a very fibrotic white line right here, which is essentially the separation, diastasis. So this is one of the more clear examples of a diastasis that I've seen. And what we're going to do is we're going to bring her rectus muscle from here and the rectus muscle from here, and we're going to bring them together to close this space, which measures a couple centimeters all the way down here, and essentially create an internal corset. I wanted to show you how we do what's called a monsplasty. So this is an area that bothers a lot of women when they have excess fullness right here. What you do is you need to elevate a uniform plane of tissue. And this is what we're going to be leaving behind, this nice thin uniform plane that we've dissected. And then this is what we're going to essentially completely resect. So all this fat underneath, we're going to come right along the abdominal wall and remove this as a wedge, so that when we resuspend this, we don't have this bulkiness. And I'll show you what that looks like here in a few minutes. This is the amount of tissue we took out from that area up here that was causing her all that discomfort and causing it to look much larger than what she wanted it to appear. And then we did tacking sutures underneath. You can't see those now, but to kind of hold everything up to make this nice and smooth. And then my partner here is simulating what it's going to look like once we close this down to the skin as well. So she's going to have a nice smooth area there. One thing about this patient too is you can notice that she's still very lax in this direction. So she's actually going to get what's called the fleur de lis. So we're going to actually now do a transverse wedge or vertical wedge right here to get rid of this tissue to really cinch everything in.